So now welcome back to part 3. So in the part 2 we have discussed till scope of physiotherapist in working in a sports medicine team. And now let's discuss about what is the role of a sports physiotherapist being in a sports medicine team during the pre-competition. So which means just before the competitions, what is the role of a physiotherapist? So during a pre-competitions, so the preparations all are made. That depends on the type of sport that we are going to play, and then duration of the sport and intensity. Or it could be a duration of a practice session or intensity. Either it is high intensity warm-up or high intensity exercises, or it could be a high intensity session or a low intensity session or a moderate intensity session. So these are all the factors has to be decided or has to be organized during the pre-competitions. Now also they do assess and treat of an acute and chronic injuries. What do they do? What is the main responsibility in the assess and treatment of acute and chronic injuries? So as a sports physiotherapist, we can treat acute injuries with the therapeutic modalities. Also we can educate athletes the importance of compression of ice. Anti-inflammatory can be provided by the sports physicians. Also from our perspective, so the physiotherapy could be intensive. We may be able to encourage some strengthening exercises along with the mobility exercises in order to regain the complete functions. Also we do a rehabilitating the injury and the maintenance of the body strength. Make sure, so prevention of reoccurrence by giving a home program, stretching and proprioceptive exercises. So what happens when you treat a player with a chronic injuries? So whatever the management is going, we have to maintain the ongoing managements, and then you can do a training modifications according to the player fitness. Now what I mean by pre-match strapping and treatments, of course, since being a sports physiotherapist, at the end, during a pre-competitions, a large percentage of the players, they use a prophylactic strapping. So sometimes they require a kinesiotaping in order to improve the psychological confidence or muscle activations. What do you mean by stretching? So as being a sports physiotherapist, so they have to provide appropriate stretching exercises. Right, depends on the, as we said, depends on the sport intensity. You can give us static stretches or dynamic stretches. It differs from sport to sport. As we discussed, it purely depends on the demand of the sport or demand of the player. Now, so what a sports physiotherapist do during an injury? See, during injury, it's a responsibility of a physiotherapist of being with the team. So for example, I can give you an example, like during a football match, a physiotherapist has to be on field, and then they have to keep an eye on their match. So we can't blink, we have to watch each and every moment of a match in order to rule out the injury. So the physiotherapist should remain on toes to prevent injury. So what do you mean by medical cover, medical screening and injury prevention during practice? So we have to have immediate medical management on the field of play. the assessment and decisions making on a player, whether he can continue to play or not. If there are any blood injuries, we have to manage the blood injuries, sprains, contusions, and hydration of the players. Now, what do you mean by liaising with the management? So, it's our responsibility to introduce players back from injury, whether this player is recovered following an injury. Upon that, we encourage the coach to reduce the volume for a player who has returned to play following an injury. It's called a gradual loading. Also, it's our main responsibility to build up a preventive exercise program, and also we have to make the athlete to be fit to play. In other terms, it's a fit to play. Now, what do you mean by referral for scans? So, who will refer the player for investigations like CT or MRI? It's a main responsibility of the sports physician. So, always we have to have close links with the hospital and consultants. So, we have to have the best surgeons in the specific region. We will be able to refer at a short notice. So, we have to discuss and join managements of an athlete to ensure quick and safe return to training or playing. Then, what do you mean by post-competition workout? So, the post-competition workouts includes 4 principles. One is recovery, second one is relaxations, rehabilitation, and psychological support. So, what do you mean by recovery? So, following a match day, the players has to have a cool down, like stretches, or most of the people they would like to have a sports massage, and very few people, and most of the, all the players, those are played on field, they have to have a pool sessions, which means hydrotherapy sessions. I could be ice bath, recovery bath, or a contrast bath. So the player has to have a recovery method, any one of the method which has been described here. Now, what do you mean by psychological support? Most of the players, if they get injured, they are feeling isolated. Also, so the players spend most of the time in rehab center than the teammates, especially the players who's been under chronic injuries. They spend more time with the medics rather than the teammates, I said. And also the players knows that conversation with the medical staffs are confidential. They're completely aware that we will not go and discuss it outside. So, as being a sports physiotherapist, we have to be support the player psychologically if he's down during the injury or during the rehabilitations. It's one of the main concept of sports physiotherapist. Now, let's look at the general role as a sports physiotherapist. As we discussed in the earlier slides, always we have to give immediate care in terms of we have to have a close links with the hospitals so that the patient or an athlete can be shifted to the nearby hospital if there are any blood vessel injury or contusion or concussions. And the physiotherapist, they helps athletes in relieving pain and heal injuries. They have the ability to increase your mobility, build up this muscle strength, improve the balance, and improve the performance enhancements. So the sports physiotherapist make individual to become independent of a daily living. They help in modification in your gait if you have a wrong pattern of gait. Also, they'll help you to improve your posture if you have a poor posture or a bad posture. Also, the sports physiotherapist helps in treating injuries, preventing injuries, and rehabilitating the injured athletes. Also, they'll help us to improve the performance. Now, so what do you mean by meeting individual needs? It's based on the three factors. One is proper athletic management, other one is reassurance, and then treatment. It is very difficult to manage athletes appropriately if you don't understand the athlete requirements. So always we have to have a mutual relationship, trust and confidence. So what do you mean by reassurance? It's purely depends on athletes. Treatment, either the treatment does take a long term or a short term. So what is the right time, what is the appropriate time for the injury to be healed, what is the appropriate time for a recovery for a player to return to play. So we have to give a reassurance. Now treatment, so according to the diagnosis, the intervention has to be made and then has to be implemented with an athlete to increase their performance. Now, so what will be the relationship between coach, athlete and the clinicians? So here the sports physicians obviously needs to have good relationship with the athlete. A feeling of mutual trust and confidence will lead to the athlete feeling that the athlete can confide in the clinicians, and then clinicians feel that the athlete will comply with the advice. Also here the coach is directly responsible for an athlete training and performance. It is essential to involve the coach in clinical decision making. So during the team meeting, so if you look at the team meeting, there will be a coach, sports scientist, a physiotherapist and then sports physicians. Four of them, they will discuss about the particular player, whether this player has an injury, how is his progress, how is it happening, what is the possible time to return to play. So it's important to have a team meeting at the end of the day, which will help in identify the players, whether they are on the right track or on the wrong track during the interventions. So always have to have a good relationship between coach, athlete and the sports physicians. Sometimes, so in other cases, the coaches might have a distrust of a clinicians. However, it is essential for the coach to understand that clinicians is also among the maximize the performance of an athlete. Now, so love the sport. So it's important. So the physical activity is much more important when you start, being as a sports physiotherapist. So as we discussed, it's a pure sports specific rehabilitation. So this is what the main objective of the sports physiotherapist. We have to increase the confidence of an athlete, and then in order to prove a skilled physiotherapist or knowledge physiotherapist, we have to attend the training as well as the competitions to update our knowledge. Here I have given you a link to understand the sports medicine team. Now here are the references. So all the information is obtained from Bruckner and Kohn, and then the role of sports physiotherapy at London 2012 Olympic Games in article. Now at the end of the sessions, I request you to write a reflective diary on share your personal experience as a sports physiotherapist working in a sports medicine team. If you do not have experience, just imagine you are working with the you are working with a team. Either it could be a football, hockey, or a cricket, or a volleyball, or a shuttle. Just imagine being a sports physiotherapist and start writing a reflective diary on it. Thank you so much.